Hello everyone, welcome to my channel Pharma Dive. This channel is purely for educational purpose and aims to provide valuable information. So, if you are ready to dive into the world of pharma, hit that subscribe button and join the journey. Let's explore, learn and gain together. Today's topic is types of disinfectants used in pharmaceutical industry. Before we look at different types of disinfectants, let's first understand what disinfection actually means. Disinfection is a process of destroying or removing microorganisms and reducing their numbers to a level that is considered safe. However, disinfection should not be confused with sterilization. Most disinfectants are effective against sensitive vegetative microorganisms, but they may not destroy heat-resistant bacterial spores. That's why disinfection is considered less effective than sterilization. Also, most disinfectants are bactericidal, meaning they kill bacteria. Although under certain conditions, some may only be bacteriostatic, meaning they inhibit bacterial growth. Disinfection is essential for controlling microbial contamination, maintaining clean room hygiene, protecting product quality and patient safety, and supporting GMP compliance. So, what qualities should an effective pharmaceutical disinfectant have? Ideally, it should provide broad spectrum antimicrobial activity, act rapidly at low concentrations, and be safe and non-toxic. It should also be compatible with facility surfaces, non-corrosive, leave minimal residue, remain stable during storage, and be economical and easy to prepare. Let's now look at the classification of disinfectants, their mode of action, activity, and examples. Alcohols such as 70% ethanol and 70% isopropyl alcohol denature proteins and disrupt the microbial cell membrane. They are bactericidal, fungicidal, and virucidal. Aldehydes such as glutaraldehyde and formaldehyde inhibit cellular enzyme activity and denature microbial proteins. They are bactericidal, fungicidal, virucidal, and sporicidal. Oxidizing agents such as hydrogen peroxide causes oxidative destruction. They damage microbial DNA, proteins, and lipids through the production of reactive oxygen species. Their activity is bactericidal, fungicidal, sporicidal, and virucidal. Phenolic compounds such as chloroclysol and chloroxylenol denature proteins and disrupt cell membranes, altering enzyme activity. They are bactericidal, fungicidal, and virucidal. Note: several classifications of disinfectants are there in microbiology literature. This presentation focuses on the major classes routinely used in pharmaceutical manufacturing and GMP environments. Next, we have bigonides. Chlorhexidine gluconate disrupts microbial cell membranes, increasing permeability and causing leakage of cellular contents. It is mainly bactericidal and fungicidal. Quaternary ammonium compounds such as benzalkonium chloride and cetrimide disrupt the permeability of the microbial cell membrane, causing leakage and coagulation of intracellular contents. They are bactericidal, fungicidal, and virucidal. Finally, halogen compounds such as sodium hypochlorite and chlorine are strong oxidizing agents that react with essential microbial enzymes, resulting in cell destruction. They are bactericidal, fungicidal, and sporicidal. Now that we know the different types of disinfectants, how do we decide which one to use? In pharmaceutical manufacturing, disinfectants should be selected based on their antimicrobial effectiveness, mechanism of action, surface compatibility, and other site-specific requirements. It is also important not to rely on a single disinfectant. A rotation program using these agents with different mechanism of action can provide broader microbial control. For example, a facility may use an aldehyde-based disinfectant, a hydrogen peroxide-based disinfectant, and a quaternary ammonium compound-based disinfectant as a part of its overall program. This approach helps maintain effective microbial control and supports compliance with GMP requirements. However, the rotation should be based on environmental monitoring trends, disinfectant efficacy studies, and quality risk assessment. So, what determines how effective a disinfectant will be? Several factors can influence its performance. These include the disinfectant concentration, contact time, temperature and pH, as well as its formulation and chemical composition. The type and number of microorganisms present also matter. In addition, organic matter, dirt, or residues on the surface can interfere with disinfection. Surface characteristics, water quality, and the way the disinfectant is prepared and stored can also affect its effectiveness. Once we select a disinfectant, we also need to demonstrate that it actually works under our facility conditions. This is where disinfectant validation becomes important. It typically includes surface efficacy studies, verification of the required contact time and in-use dilution, along with checking material compatibility and residue. Environmental monitoring trends can then help confirm that the disinfection program continues to provide effective microbial control. Finally, let's look at the key guidelines that support disinfectant use in pharmaceutical manufacturing. These include USP 1072 for disinfectants and antiseptics, USP 1116 for microbiological control of aseptic environments, EU GMP Annex 1, WHO GMP, the PICS GMP Guide, and ISO 14644 for cleanroom requirements. Together, these guidelines provide a framework for effective contamination control and cleanroom management. So, to sum up, there is no single disinfectant that works best for every situation. The right choice depends on the microorganisms involved, the surface compatibility, the intended application, and other factors such as residue. A well-planned rotation program, supported by validation and routine monitoring, helps maintain effective microbial control. Ultimately, a proper disinfection is a key part of contamination control and maintaining product quality in pharmaceutical manufacturing. Thank you for your time and attention. I hope you found this presentation informative. If you have any questions, feel free to ask. And if you enjoyed this presentation, then don't forget to like, share and subscribe to Pharma